Hey guys, it's Tina, and I'm back to making videos again. I finally have a decent setup that hopefully won't fall over on me like it has before, and I had stopped for a while because A, I had a lot of things going on in my life, and B, I just honestly kind of lost the motivation with everything that was going on, with how sick I was feeling. But today I'm going to talk about Rituxan because that's what my current treatment is, and it luckily so far seems to be working for the rheumatoid arthritis portion of my autoimmune issues. So Rituxan is actually a chemo drug. They use it for leukemia and certain leukemias and lymphomas, and it's basically works by killing off the B cells in the immune system so that they stop attacking the body and the joints in the case of the rheumatoid arthritis. I haven't noticed any difference in the lupus symptoms, which are more of the fatigue and non-joint pain, and there's other illnesses that come with lupus that are still kind of occurring, but it is wonderful to be able to walk around and, use my hands much more easily, use pretty much all of my joints much more easily. I've been really happy with the results of that. I had 2 infusions about 5 months ago, and I am now getting infusions again. I just had one last Friday, and I will be having another set of infusions next Friday. So get infusion, take a week off, get a second infusion. And Rituxan is every 4 to 6 months as needed. So some people get Rituxan and then they don't need it again for, a year. Or one person I met had it and hasn't needed it in 3 years, which is wonderful for her. I'm probably going to be one of those people that needs it on a more regular basis, just because of how it's been working and just how my body tends to respond to medications in general. But everybody's different, and my body what might also change with time, so we'll see. On top of the Rituxan and the autoimmune issues, some of you may know I also have chronic pancreas issues. I have a sphincter of Oddi defect, which means that the sphincter muscle between my pancreas and my small intestine will close off and will not open back up. So I've been seeing a doctor, a really good doctor at Columbia Presbyterian, Dr. Pancreas, who has been doing a procedure called an ERCP, which is a very nice set of initials for a very long name that I'm not even going to bother with because it doesn't really make much sense unless you're in the medical field. And they basically take they do an upper endoscopy, and then they go down to the area of the small intestine where the sphincter of Oddi is, where all of the everything comes out from the common bile duct. So everything from the liver, the gallbladder, and the pancreas come out through that sphincter from the common bile duct. So that's what makes that the common bile duct. And then for me, like I said, it just closes off. We don't know why. And so Dr. Pancreas has been, sorry, the cat, has been for the last 6 years for me, whenever that closes off, he's been going in and doing a little snip on that sphincter that closes off, and then puts a stent in where he does the snip to allow the sphincter to heal open. And theoretically, the first time I had it done, I was told it should last about 5 years. I've had it done 7 times in the last 6 years. Last month was my 6-year anniversary of my first pancreatitis episode. So now we are have come to realize that this procedure is not working for me anymore. I had it done, like I said, I had it done 4 months ago, and then I had it done again a couple of weeks ago. Well, it was 4 months anyway. So the long story short is that the procedure is no longer working, that procedure. So I need a more permanent surgery, so I was referred to a surgeon at Columbia Presbyterian, and she will be doing a procedure called a transduodenal sphincterplasty, which basically means that I get a nice 6-inch incision in my upper abdomen, and she will go to my duodenum, which is the part of the small intestine where the sphincter of Oddi is, and she will cut open the sphincter of Oddi in a particular way where she can then pull back the pieces that she has cut and stitched them so that the sphincter will be open all the time. There will be no more sphincter there, period, end of story at this point. And hopefully that will be the last pancreas surgery I will need. However, she said that there are some people whose bodies do close that off again, and given my history and my luck, I may wind up being one of those people. But I'm trying to think positive and hope that this will be the last pancreas surgery I will ever need. So I will be having that surgery on September 23rd, which I kind of just can't wait to get it over with. It's a 6 to 8 week recovery time after 5 days in the hospital. If after 5 days in the hospital I am no longer sick enough to hi Dante no longer sick enough to be in the hospital, but am not well enough to go home, then I will go back into a nursing home like I did after my back surgery, so I can be the youngest patient in the nursing home again, which was actually kind of fun. And I am getting the Rituxan done now before the surgery in hopes that it will prevent me from having a massive flare-up of the rheumatoid arthritis and the lupus after the surgery, because surgery throws your immune system into complete and total chaos. So there's always the chance that surgery will cause a flare-up, and both doctors are hoping to reduce that risk by having me have the Rituxan done now. So that's pretty much the what is going on with me now. And I know I've been promising everybody a video for quite a while on feelings of guilt with chronic illness, and I'm actually trying to get some advice, and I'm going to be talking to a friend of mine who is a therapist who specializes in gratitude. She's been published many times in books, in papers, in magazines. For her 40th birthday, she had an article posted in the Huffington Post. So she also is a professor at Rutgers University. So she is very, very qualified in her field, and I am very, very lucky to not only know her professionally as a patient, but also personally. She's a wonderful person. Her name is Dr. Colleen Georges, and I will put in the box the links to how you can find her and her material, and it's definitely worth looking over, especially for people with chronic illnesses. She's been extremely helpful to me, more so than I think she could even know. So I highly suggest that you look into that, and hopefully with her help I will be able to put together a really good video on the feelings of guilt and how to best deal with them. So this is me signing off for tonight. I hope everybody has a great weekend coming up, and hopefully I'll have another video up relatively soon if I can get my act together and get everything in gear. Thanks for watching, everybody.